Hi, I'm James O'Neill, the volunteer state president of AARP New York. We're so pleased to be collaborating with the Empire Report for this vodcast of a proposal that would provide critical support to New York State's unpaid family caregivers. Every year, 2.5 million New Yorkers provide unpaid care to older loved ones that's valued at over $31 billion. This is an emotionally draining job and a financially draining one, too. Family caregivers spend on average $8,200 from their own pocket every year on caregiving expenses. That's why state senators have proposed a tax credit for family caregivers and included it as part of their budget proposal. But we still need the Assembly and Governor to act. To discuss this groundbreaking proposal, I'm pleased to be joined by David McNally, AARP New York's Director of Government Affairs and Advocacy, and Doris Green of the New York State Caregiver and Respite Coalition. Topic of the day, update from Albany on a proposal to provide some desperately needed financial relief to unpaid family caregivers. What is an unpaid family caregiver? Who are they? How many are there in New York? What challenges do they face? Doris?
Well, an unpaid family caregiver is anyone who provides care around activities of daily living, like a friend, a spouse, a sister, a daughter. It's just somebody who's in a close circle of support with someone who needs assistance. And we have 48 million caregivers in the United States, just of older adults alone.
David, what are current proposals to help unpaid family caregivers?
Well, thank you, James. And building off what Doris said, in New York alone, there's an estimated 2.5 million unpaid family caregivers. They are struggling to keep their loved one home where they are healthier, happier, and safer. We know the pandemic has created even more challenges for the unpaid family caregiver, and that some of them desperately need some financial assistance. Now, there are a lot of programs and services available to the loved one for whom they care, and there's some respite and some training and support groups for the unpaid family caregiver, but there's very little, if any, actual direct financial assistance to the unpaid family caregiver in New York. So that's why we were thrilled that the state Senate included in their one House budget proposal a modest pilot 2 to 3 year program that would provide a tax credit for the unpaid family caregivers in New York. We think this would be a tremendous assistance to the unpaid family caregiver. It also provides some recognition from the state of New York that the unpaid family caregiver is not just a nicety, it is a necessity in the long-term care system, and that the unpaid family caregivers deserve respect and recognition and some financial assistance. So the unpaid family caregiver tax credit proposal in the state Senate, one House budget proposal, is something we think it's long overdue. And yes, we were disappointed that the Assembly and the governor did not put this in their own budget proposals, but we're fighting hard to see that it gets in the final budget. And the proposal as it currently stands would be up to $3,500 for an unpaid family caregiver. And we know that in New York, an unpaid family caregiver, research shows on average spends over $8,200 on out-of-pocket expenses. So this modest tax credit of up to $3,500 or 50% of their out-of-pocket expenses, whichever is less, would be very helpful to the unpaid family caregiver. And the expenses involved in unpaid family caregiving are unlimited. Home health aides, nutrition, adult daycare, transportation, housing modification, medical equipment, wound care, co-pays. I mean, the amount of money that is going out of the unpaid family caregiver's pocket to keep their loved one home is really changes from caregiver to caregiver. I, as a family caregiver, my expenses may have been very different from someone else's, but it is expenses nonetheless, and we believe the state should be providing some financial assistance to the unpaid family caregivers. So the proposal as I said, is up to $3,500 tax credit. You have to be qualified as an unpaid family caregiver. And there are income limits, of course, on this. But it would be a dramatic and historic step forward for New York to finally recognize the important role these unpaid 2.5 million unpaid family caregivers are providing to their loved ones at home.
Doris, what are the financial burdens and expenses unpaid family caregivers face?
Well, Dave just listed a few of them, but the out-of-pocket costs can be huge. Just to get a little bit of assistance, so many people have to hire home care workers to help them, medications, any costs of daily living. I had my mom live with me, and so I paid for food and clothes and all the things that it takes to keep a person going through the day. Sometimes you have to pay for programming, so it's pretty immense what caregivers give of themselves and out of their pocket without thinking twice about it. But it does cause a strain on family finances for sure.
David, who is supporting the tax credit and who's not? Where does it stand?
All right. Well, the tax credit, it was introduced as a standalone bill, and in the Assembly, the sponsor is Assemblyman Kim, and in the Senate has been Senator May, both the aging chairs, and we very much appreciate the work they've been doing on this. But right now, standalone bills like that involve a significant expense really need to be done as part of the budget process because it involves money. So this year, the state Senate has included it in their one House bill. The Assembly and the governor did not, but we're hoping at the negotiating table that they see the light, have a heart, help these people that are working at home, often alone in the shadows. Unpaid family caregivers, they don't have a strong union out there that are negotiating higher wages for their employees. They don't have a hospital or nursing home association out there fighting for higher reimbursement rates. They are alone. They are working on their own. They need the support of everybody. So we are very supportive of this, and over 40 organizations signed a letter to the governor last fall. And I think it's important that the breadth and depth of the support is known. So I'm just going to read some of them. AARP, the American Nurses Association, the Asian American Federation, the Brain Injury Association, Caring Kind, the Elder Law and Justice Center, Advance Our Community, City Meals on Wheels, Every Home Care Advisors, Global Healthy Living Foundation, the GHLF Creaky Joints, the Hamilton Madison House, the Gray Panthers, the Live On New York, the Long Island Lobby Coalition, Lifespan, Live On New York again, the Long Island Lobby Coalition, Medicare Rights Center, the NAACP, the National Multiple Sclerosis Association, New York Oncology, Hematology, Statewide Senior Action, the New York Urban League, the New York State Association of Healthcare Providers, the New York Vision Rehabilitation Association, Next Wave, Piero, Connor, and Strauss, the PSS, Share the Care, the Geriatric Mental Health Alliance, the New York Academy of Medicine, Vibrant, and Vision Long Island. And those are just some of the organizations that have been supporting this effort. So you can see the support for this is broad across various groups that support caregiving, various disease and disability groups, aging organizations. I mean, it really runs the gamut. And we know as far as the support goes, the public supports this. We did a poll last fall, 84% of registered voters support a tax credit for unpaid family caregivers, 84% across all political lines. And it's rare these days that you get that high level of support for something among all parties. So we're very excited about this, and we're very hopeful that the Assembly and the governor in these last days of negotiation will include and agree with the Senate to include an unpaid family caregiver tax credit in the final budget.
What can people do to push for a tax credit in this year's state budget? And where can family caregivers go for more assistance?
Well, I'm going to leave the latter up to Doris because that's what she does and does it remarkably well. And we're so excited that she was able to join us today. The best thing people can do right now, I mean, today is March 28th. There's supposed to be a budget due by April 1st. So those budget bills have to start getting printed pretty soon. So the best thing everyone watching today could do was pick up the phone and call their state assembly member. And they can call toll free at 844-489-1325 and urge them to support the Senate proposal to include an unpaid family caregiver tax credit in the final adopted state budget. So that toll-free number, call your assembly member today. Don't wait. That toll-free number is 844-489-1325. And Doris, do you have some suggested places where caregivers can go for assistance?
I do, and I also just want to add that so many of our caregivers have to leave the workforce early, either to part-time or completely, and because of that, they have a loss of their Social Security building up, loss of pension, loss of health care. I mean, so the cost to the caregiver directly, not only for what they're paying for to help their loved one, is just so immense. This is just such an important piece of legislation. So as for supports and services, we have it's called New York Connects. It's the #1 information and referral service in New York. You just have to call 1-800-342-9871, and they can provide you with housing options, how to get Medicaid, where to find services in the state. So that's the big one. And they also have a website. It's newyorkconnects.newyork.gov. And I would just like to say that I run a coalition called the New York State Caregiving and Respite Coalition. We have a lot of resources on our website. We also have some programs to help pay for respite, and respite is care for the caregiver, giving caregivers a break. So please don't hesitate to go to the website at nyscrc.org and see what it is we can do to help support our caregivers. You do such important work. Thank you.
Thank you, Doris. And James, I just wanted to piggyback on something Doris said about the financial stress of a caregiver who has to reduce their hours or quit their job or take more time off. The other financial angle of this is about what all of those people doing unpaid family caregiving at home are keeping their loved ones out of institutional care, which can run $130,000, $140,000 a year, and usually paid for by taxpayers through Medicaid. So any modicum of support we can give the unpaid family caregiver, it's beneficial to the unpaid family caregiver, to the loved one, but frankly, it's beneficial to everybody as a taxpayer to keep people out of very expensive nursing homes that are paid for by Medicaid through our tax dollars as long as possible. So I just wanted to add that too.
Thank you, David McNally and Ms. Doris Green, for your participation today on the panel. It's been very informative, and I want to remind everyone that you can call the Assembly by calling 1-844-489-1325, or you can contact AARP at the AARP website, aarp.org/NY. Thank you for joining us today. We think this was informative. Hope you've enjoyed it, and hope you will follow up and help us out with our caregiver issues. Thank you and have a good day.